Waterloo.
Thank you very much, Madam Speaker, and it's a pleasure for me to join this debate today. It's an issue that's been close to my heart for many years since I first became a school board trustee. I think the context, though, for this debate is important, as are the facts. It is true that when the PC government beat the Liberals in the last election, they cancelled then the $2.1 billion in additional mental health services that the previous government had promised over 4 years. Now, the health minister of the day, and the premier will recognize, he used to say that there's no health without mental health. I mean, it was a quote, a slogan, if you will, but there wasn't a lot of stable funding for so many years in this province. And so this was a last-ditch effort for the Liberals to essentially save face on the mental health file. However, that means that when the PC government cancelled that plan, that means essentially they cancelled the $525 million annual injection in new funding, which was already in the system because the budget had already passed. So this means that that is a reduction in year of $190 million. That is the fact. And unfortunately, this government has said, we're going to do matching funds with the federal government. The Trudeau government, in keeping with the way the Liberals operate at the federal level, have back-end loaded the funding. So most of the funding is in a decade. And we know that there is a crisis in mental health today. When I first chaired the Provincial Association's Mental Health Advisory Committee, which included healthcare professionals and school boards, mental health frontline agencies, one of the major messages that they gave us around that table was that they need stable funding. They need stable funding year over year. So this government, while they have said that they will put the $1.9 billion in, matching the federal $1.9 billion over 10 years, that actually is a reduction in funding because the agencies and the frontline workers had banked on the $2.1 billion over 4 years. So that is the situation that we face right now in the province of Ontario, and that is why the member from London Fanshawe, to her credit, has brought forward this motion to draw attention to this cut in this year to mental health services. And so the stable funding, which every agency in the province right now, in all of our ridings across this great province, will tell you they need the money now. And when they hear from the government that some of that reduction in the funding is going to police services and it's going to correctional services, their fear, because they have no trust in any government, in any party on this file. This is the fact. They see the money perhaps going to corrections. Corrections needs funding on mental health. Police services need the resources to learn about de-escalation on the streets to deal with mental health. Police services need those. Our correctional facilities, I toured Vanier. I saw things in Vanier that I wish I could unsee. When people are in solitary confinement and they are suffering from mental health, it is a form of torture, of cruelty. Truly it is. So what we need from this government is don't tie the mental health strategy to the federal Liberals. The federal Liberal plan is a weak plan. It doesn't serve the needs of right now. It doesn't serve the needs of the 13,000 children who are on wait lists in the province of Ontario. It doesn't address even the need for supportive housing. And we all know, and you should know, that housing is an economic driver. And with the social determinants of health, which the Select Committee 10 years ago discovered, are the driving force to the high rates of mental health crises in our province. So the comprehensive plan that this government is talking about, we love hearing that language. But you also know that we've heard 15 years of that language. And if the Select Committee from 2009, if those recommendations could be put into place, those recommendations would be driving a massive infusion in mental health funding today, not in a decade, because the crisis is now. And we have a moral and an ethical responsibility to ensure that if you are going to follow through on the numbers that you talk about, that there actually is real cash attached to that. And you know how to streamline that funding So if you want to make a difference in the justice system, in the healthcare system, in the housing system, which is there are more people right now in the province of Ontario on a wait list for affordable housing than there are in housing units. So this is going to escalate. This is going to get worse. And what the people who have been fighting, the advocates for mental health, the educators, the parents for mental health are very concerned right now. They want to see the stable funding. They want to see it in real dollars, in a real budget. And this motion draws attention to the fact that in this year, if you tie your plan to the federal plan, we won't make the progress that all of us want to see. Thank you very much, Madam Speaker.